Okay. Hi, everybody. We are here with the first segment or volume or edition of 5 questions. And for those of you who don't know me or what 5 questions is, my name is Erica Lessa, and I am a certified dog behavior consultant. Also have some certification in technology and training. And I decided to try something out in this time of lockdown, and that is to draft 5 very pointed questions on any given topic and pick somebody to collect their thoughts about said topic. So here we are. I'm going to introduce you to my first guest, Dr. Tracy Carreiro. How would you like to introduce yourself?
Hi, I'm Tracy Carreiro. I'm a graduate of Tufts University School of Veterinary Medicine a long time ago. And I've been practicing about a little more than 30 years. And I've realized that behavior is really critical to the health and well-being of our patients, and also, and maybe more importantly, or just as important, to the bond between animals and the humans who care for them.
Awesome. Awesome. Yeah, that's great. Thank you for doing this. Really appreciate it. So our topic today is going to be FAST, which is our wonderful acronym for fear, anxiety, and stress. So I have 5 very specific questions I'm going to pepper Tracy with. We're going to try to get this done in under 30 minutes, but that's a tall order. So we're going to do the best we can for this first one. The first question is, what is FAST, which I kind of just tipped my hand there a little bit, and what distinguishes one from the other?
So, as you said, FAS is the shorthand for fear, anxiety, and stress. And, after you sent these questions to me, I thought, well, I've always just sort of made the assumption of what these things are. So I went ahead and I looked them up in the dictionary, and I thought that was a really interesting way to do it. So fear is a dictionary definition, the unpleasant emotion caused by the belief that something or someone is dangerous, likely to cause pain, or is a threat.
That's very interesting.
Yeah. Anxiety, dictionary definition, is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. So we're starting to distinguish the two. I feel like it's an anticipatory type of feeling, and there's also a piece of uncertainty, whereas fear is more like, this is scary or dangerous. Anxiety is more like, this might be, I'm not sure.
So do you feel like fear is almost an unconditioned response to something that an animal would try to avoid or escape because they feel like they're being threatened in that moment? So like there's a real attachment to a threat as opposed to an uncertainty and an unable to predict? Would that be close to what you're getting at?
Yeah, I think in a way, but I think that, so there's probably a genetic component to fear, that animals are and we are programmed to have a fear response to, if you've ever been to the zoo and you've heard a lion roar, there's this sort of visceral thing that happens in your body.
Mm-hmm. Yeah, definitely.
And that's a primal sort of, I don't know, I think of it as genetic.
Right, or so unconditioned would probably be valid.
Right.
In that.
Right.
Yeah.
Unconditioned in that response. But I also think that, we and animals also learn to be fearful of things because of their association. So that's a conditioned response.
Yep. Awesome. So and what about stress?
Stress. So the dictionary definition of stress, which I'm really pumped up about, is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances.
Nice. So there is the distinguishing factor in that definition between emotional and physical stress. Mm-hmm. Right?
Right.
So how do these 3 things, and this is kind of a little question 1B, I think. How do these things, so that's what differentiates one from the other.
Yep.
How do they play together?
Well, I guess the way I think about it is that they often play together. They're very tightly interrelated in a lot of situations. But one of the distinguishing things that pieces that I draw is that I think stress, there can be good stress and bad stress. So stress can happen in a learning environment, for example, that's demanding. We're training a new behavior potentially, and sorry, that's me, the ding, I think. So if we're training a new behavior, that can add stress because it's demanding, mentally demanding to a dog or a cat. And so I think that fear and anxiety are separate in that situation. But stress is definitely a part of any situation where there's fear and anxiety. Sort of stress is involved.
Right, and that would be because there's a demand on the animal physically and emotionally. So stress is like a demand. So is that demand reasonable for that particular animal or individual, or is that stress so intense that we're talking about the animal actually experiencing distress as opposed to, stress that's a reasonable ask? And I would imagine that ask would be different for each individual animal or human or being.
Absolutely. Yeah. What's physically or mentally or emotionally straining to me may not be the same thing for you. And we see that all the time in our cats and dogs.
Exactly. Yeah. Fun little anecdote. I decided in this moment of being locked in my house for 21 days now that I was going to get up and run a 5K. So I did. It was fun and it was a little stressful, physically stressing my body, but not anything that I couldn't handle. And when I told a friend of mine, they were like, no, couldn't do it. Couldn't manage that. Too much of an ask, right? I would imagine there's probably a mental and physical component to that as well. Because I don't think if I wasn't mentally ready that I would have been able to pull that off.
And you probably wouldn't have woken up in the morning thinking about doing it either.
No. I would have been going for my my big breakfast and cup of coffee. So drilling down into the labels, if you walked into a house to see a client and you were assessing a client for the first time, what would you see behaviorally that would distinguish fear from anxiety from stress, or point you in the direction of which combination was actually impacting that animal based on the behavior that you were trying to diagnose?
Well, I think physiologically, fear and anxiety have tons of overlap. So the things that we think of as fear behaviors, dilated pupils, increased elevation in heart rate, elevation in respiratory rate, hackles raised, those sort of physiological signs of arousal, I think can be present both in fear and anxiety. Mm-hmm. I don't think those are necessarily present with stress. They can be, but if it's just stress, I don't think that they necessarily need to be there.
Okay. And so if we moved away, so I'm coming at this from a pure behavior lens, right? So when I'm thinking about behaviors that I'm observing for, I'm thinking about maybe head turns away to indicate avoidance, maybe pacing, maybe whining, barking, crying, maybe staring out into the distance. So if you were actually observing a dog and you were watching for observable behaviors that dog was giving you, would there be some classic sets of behaviors that you could observe that would separate those things out? Or is it really just being a good diagnostician that would allow you to kind of point yourself in the right direction?
Well, I think that fear, anxiety, and stress to me they're contextual. Mm-hmm. So I think fear and anxiety can look the same. So it depends on the context.
Got it.
Of what they're showing in that particular circumstance.
Sure. So if I could think of an example, see if I'm following you correctly. Let's say there is a dog in its home environment with its owners, and you're observing on video, so you're not present in the home, mm-hmm. and you saw panting, drooling, pacing with no discernible environmental stressor that we could see. Would that be more of an indication of anxiety,
I would
probably call it anxiety.
I would call that anxiety.
And that would be, of course, understanding that, there wasn't a bear on the deck or something like that, right?
Right. And if there was a bear on the deck,
yeah,
I would call that fear.
Fear. Yes. Got it. Okay. So, I think we've kind of danced around this third question, which is really interesting. How do fear and anxiety and stress fit together? And can you have one or some without the others? I think we did a really good job at kind of starting to look at that. Is there anything that you want to say that gets a little bit more specific about maybe things that would discern one from the other, or talk about maybe a case where you had all three? And if you do have all three, where do you start?
Well, when I was thinking about this, I was thinking about a very particular scenario that came to mind that I think is kind of easier, I guess, to distinguish fear, anxiety, and stress. And it's around veterinary visits.
Okay.
A puppy comes in for its first visit. It's kind of a clean slate, right? We don't have any conditioned responses at all. New place. So the pup has no expectations necessarily. So comes in, say we don't need to give a vaccine. It just gets, examined, played with, everything goes pretty well. And pup takes its treats, wags its tail, seems soft and relaxed, everything goes well. Pup goes home. I would say that there's stress in that circumstance because that's a new puppy, new situation, meeting new people, handling behavior that may be new or uncomfortable to be handled by strangers. So there's stress there.
Mm-hmm.
If we are seeing relaxed behavior, wagging tail, probably no fear or anxiety in body language.
And so we could actually use in that situation, a synonym for stress would be demand.
Demand,
right.
That
we're demanding something from the animal, but it's not something that is outside of their ability to manage.
Right.
Whereas if demand gets too high, that could tip into some anxiety because the animal wouldn't know how to resolve it.
Or maybe some fear because now it's feeling threatened or endangered.
Right. Got it. Very good. I like that example a lot.
Okay. So then we continue that example on. Yep. Say the dog has, cuts its toenail, wrecks its toenail, and now it has a painful toenail that needs to be clipped. Mm-hmm. And so the dog is upset, physiologically aroused because it's having some pain. And then the veterinary team has to do some uncomfortable things to it. So say we don't sedate the dog so it, is feeling that toenail getting clipped, and that's uncomfortable. So that's probably some fear, pain, mm-hmm. stress.
Yep.
And then the next time the dog comes to the vet, it may start to pant, pace, drool, vomit in the car as soon as it turns onto the street where the veterinary office is. That's anxiety.
Right. And that's really tricky, right? Because it also could be a conditioned fear response. And so, that's something that I'm constantly asking myself is where is it a conditioned fear response? And if that dog is actually anticipating a painful response, then could we have a conditioned fear response without any anxiety? Like maybe it's not anxious as much because anxiety contains a portion of unpredictability. Maybe that dog is very much settled in the fact that it is perceiving threat and anticipating pain. Mm-hmm. So, is that conditioned fear, or is that anxiety because, I don't know, there's some unknown factor in the experience? So, where do you?
Yeah, so I picked that. I picked that scenario specifically because I think being in the car on the street is anxiety, because the dog is uncertain. Like, am I going to turn into the vet hospital, or are we going to go by and go to the trail for a walk?
That's a great point. That's a great point.
So there's that uncertainty. I think when you walk into the veterinary clinic in that scenario, maybe then that's a conditioned fear response, or walking into the exam room.
Yep.
Or into the treatment area where the procedure happened. Now we're getting more toward conditioned fear. But I think that's a scenario where it's difficult. I think fear and anxiety go hand in hand.
So what I'm hearing also is that stress is always involved because we're asking something of the animal, whether it's positive, negative, or whatever.
There's a demand.
Yep, there's a demand on that animal's body and mind.
Mm-hmm.
So we have some stress. When it tips over to fear and anxiety, is it safe to say that we're now in distress as opposed to stress? And is simple stress always productive if it stays stress and does not cross the line into distress?
Interesting. So I think that stress can be debilitating. So I don't think stress is always okay.
So then would you call it something different? Or would you just say it's debilitating stress? And is that just the same as distress? I'm not sure how. And I know these are all constructs and labels, but I'm just thinking like in terms of our shorthand, I'm also a technologist, so I like to be scientifically correct. If I do use a label, I don't have a problem operationalizing this label. But what are we understanding as, stress is obviously the absence of stress, and then you have stress, which is demand on the animal. And then is distress a demand on an animal that they can't meet or escape?
Yeah, and I think distress, as we're talking about it, I think that distress has a set of abnormal behaviors that are associated with it, whereas stress can have completely normal behaviors.
Yep, love it.
Does that make sense?
That does, like it. Okay, so number 4, how can a daily diet of fear, anxiety, and stress impact an animal? And is there a point of no return?
Such isn't it? Isn't it? A daily diet of fear, anxiety, and stress can create a whole host of problems in addition to a whole lot of abnormal behaviors, but physiological changes in the body that can be very, very harmful. So, long-term chronic stress impacts our immune system negatively. So we have less ability to fight off diseases or to make a good immune response in our bodies when we're under chronic significant stress. So that's something that I'm sure our patients are feeling as well.
Yeah, and what about so something that an owner may be able to observe? So can you describe some of the physiological changes that can happen to an animal that's experiencing ongoing fear, anxiety, and stress, even if they're incidental, close in time? What would they be looking for physically that may lead them to be concerned? Are there things that they can actually observe, like gastrointestinal disorders, diarrhea, vomiting, that kind of stuff, restlessness, inability to sleep? So what are our pet parents looking for that would be like a red flag for them?
All of those things. So chronic fear, anxiety, and stress can impact almost all of the body systems, and you can see all sorts of sickness behaviors. So I would say the 2 most common ones are going to be intestinal problems, decreased or increased appetite, vomiting, diarrhea, commonly. The second body system that I think people can see are skin issues.
Okay, good. That's awesome.
Lick granulomas, chewing of feet, hair loss.
What about dander, excess dander?
Excess dander is really part of the physiological arousal thing. So like that kind of happens, when a dog raises his hackles, those little flakes pop off. So that's I use that as a very quick, immediate notion that there's fear and anxiety going on.
Yeah, we see it a lot with
that the dander starts popping up. I'm like, whoops.
Yep, exactly. And that's easier to see in dark colored dogs too, right?
Yeah.
Okay, so point of no return?
I'm not sure about that. I think that I think that maybe the point of no return depends on the other end of brain development. It's like, what was this, and how resilient is this animal's brain
Mm-hmm.
to start with? And that happens with the epigenetics of, I'm in what's going on in utero, what's going on as a newborn.
Mm-hmm.
Has this dog or cat's brain been able to develop normally, and is there some resilience? If we have, I think that the bad stuff happens when we have a patient who's had a really hard start to life and maybe has some abnormal brain development because of its early situations. And then we expose it to chronic fear, anxiety, and stress. Those animals don't have the resilience to bounce back as well as others.
Dr. Overall was reading a little bit before we met on generalized anxiety disorder.
Yeah.
Is that successfully treatable? What is your experience once it gets into a generalized disorder for the animal? How difficult is that to treat, and what impact does that have on the owners or the quality of life of the dog?
Yeah. So I guess the first question to ask is like, what are our treatment goals?
Great question.
Yeah.
Right. So yeah, because some goals for some owners may be very manageable, and some goals for other owners may be completely out of reach. And as a behavior consultant, I feel very strongly not to judge either of those. I think it's really important in on my side of this equation to simply help them decide what their goals are and help them determine whether they are realistic. And if they're not realistic, how much work would it take for us to get there? And on the very outside, if I think you just kind of, to steal something from Chris Packle, you work until there's some definitive amount of information that you either can't go any further or you can't improve this dog's quality of life anymore. And, everything has been tried and tasked. And now you're at a point where you have to decide, if this is as good as it gets, is it okay? And that's definitely a very personal decision for the family based on all these things that we're talking about.
Yeah. So, I think about it in very sort of Ann Landers kind of terms, is there more good than bad? That was always what Dear Abby said when somebody was thinking about leaving their husband, Is there more good stuff than bad stuff? And when it turns, then that's when you're in trouble,
Yeah.
So I ask that question a lot of my, really difficult behavior patients. Do they have times when they're happy and relaxed and
joyous?
joyful? Yeah. Because that makes a huge difference.
It does, definitely does. And I know we have some clients that, they go through a string of really tough patches, and then they go through a string of really good Ds. And I think it is important to take a step back and kind of lift your head and look at the big timeline of your animal's life, and try not to get too mired down in a moment that's highly emotionally charged when you're making these kind of decisions, right? So, yep, go ahead.
No, and I think now's a good time to point out, that FAS isn't just about the dog. It's about the people who live with the dog or the cat.
Yes.
Fear, anxiety, and stress happens to us too.
It does.
When we're treating a behavior problem, we're not just treating the patient, we're treating the patient and its environment, which includes its people.
Absolutely. Absolutely. That's a really great point. So if a client or an owner who may or may not be watching this, well, hopefully they are watching this, sees signs of fear responses, or a general anxiousness about their animal, or some stress that seems a little more than they would expect to see in any situation, what would be the single most powerful thing that they could do to help that animal, either in the moment or for its existence, like for its world, for its life? How can they either change the environment or address that in the moment to help their dog?
Well, I think the first, I guess the best thing that people can do is really start to learn how they can listen to their dog. I think that's probably step one, is recognizing the behaviors and recognizing when they're not there.
Mm-hmm.
Because some dogs have a low level of anxiety that is with them most of the time.
Yeah.
And until do you have a friend who's anxiety needing pets? So I think that learning what your animal, your cat or dog is communicating to you is probably the single best thing you can do.
So awareness is the single best thing.
Yeah.
So from a behavior standpoint, I'm gonna weigh in on that question a little bit too. I think that what we have definitely seen as we're talking about these questions is that the more predictable our responses to our animals are, their daily life is, their world is, or any given situation becomes, the easier the animal is going to have being involved in that situation, right? So the more predictable it becomes when visitors come to the house, or the more predictable it is when they're expressing a need that needs to get filled, the more predictable our responses are to them, no matter what they do. I would say that may be something that you could do not only in the moment, but long term. Creating a predictable environment would allow these dogs to have more, they'd be more settled about really understanding and even getting conditioned when this happens, and nothing else. So when I put my paws up on the counter, I don't get yelled at and I don't get hit. I get asked to go to my mat consistently. Right? So I think that may be helpful as well. And I also think it's easy to get overwhelmed because, like you said, amazing point, that the owners are feeling some stress around their dog's behavior as well. So that can be like just two beings kind of feeding off of each other until the fear, anxiety, and stress goes right through the roof. So it's also good to get another perspective if you see that happening a lot. Calling in some reinforcements is never a bad idea.
Absolutely. And I agree. I think that you use the word predictability, and I think the other word that I like to use is consistency.
Yes, that's a great word.
If A, then B.
Always. Yes, I think that's right. And I know there's a lot of kind of, some people don't mind comparing dogs to small children. Some people have an issue with comparing dogs to children. I don't have an issue with it. But it's like if you have a kid, giving them control and choice and predictability. So that's another thing that we didn't even touch on. And maybe that's another session of 5 questions, is how do we reestablish choice, control, and consent for our animals, which also can reduce fear, anxiety, and stress. So maybe we do that next time.
Sounds great.
Awesome. So any words of wisdom that you'd like to impart as we wrap up?
That's interesting. Well, I think that just being on the lookout for fear, anxiety, and stress in our pets is one of the kindest things we can do for them.
I agree with you. If anybody watching needs to get in touch with you, is there any contact information that you would like to share?
Sure. You can reach me by email at Tracy Carreiro at behaviorconsults.com, and I bet you can use your little magic keyboard there to put that somewhere.
I can.
Webinar.
Yeah.
And I'd love to answer any questions or help out in any way I can.
Awesome. Yes, I will put in a nice little title screen at the end with our contact info. If anybody needs me, I am at cooperationk9.com, and you can also find me on Facebook at Cooperation K9. Also floating around Instagram. I think pretty much whatever social media tool you use, you can probably find me. So that wraps up our first 5 questions. Next time, I think we're going to be doing it in about a week, we are doing 5 questions on puppies and COVID-19.
Ooh, how exciting.
Fun, right?
All right.
Okay, Tracy, thank you so much. Talk soon. Bye.
Pleasure. Take care. Bye-bye.